like to invite Dr. Amin Islam. He's the faculty of hematology of PHA. He's a consultant hematologist in University College London Hospitals of United Kingdom.
Assalamu alaikum. Thank you very much for inviting me to share I'm not going to talk much about the clinical aspects and other things. I want to just share my ideas and how we train our doctors. I was told that we have 100 medical schools, about 7,000 to 10,000 doctors coming out every year, and I think we need to foster them better, train them better, make them the world-class doctors for the futures. When he's fixing it, I will just share how we train our junior doctor, what is the pathway to get them to the consultant. That's very important. And I take the opportunities here that we have all the leads and the leaders and the healthcare authority and the policymaker. So if we work together, then I'm sure we can support this future generation doctors very, very well. So don't worry about these slides. In the United Kingdom, when a doctor passes, we give them the job called foundation doctor. So foundation doctor is 2 years, and followed by I take an example of the internal medicine. We call it IMT, which is 3 years. So you have 5 and 3 5 years, and then they have another 4 years to become consultant if they have a training post secured. About half of the doctors, they secured the training post, and some of them, unfortunately, they don't. So once they get into the training post, it is our responsibility to foster them and make them a consultant. And how we do it, we use the e-portfolio system for postgraduate doctor training, and this is incorporated with the Health Education England, Royal College of Physicians Joint Training Board, and General Medical Council, together with the deanery as well. So we have a number of people coming together to train our future doctors. So every year, I wanted to just highlight this learning on the go is the Dundee curriculum we've been adopting globally. As you know, our curriculum still in the United Kingdom and America is the Cambridge curriculum we use. So we send our doctors to the ward in 3rd year. So they spend only about 2 years in the clinical environment. So we're coming out from this. So what we do in the UK now, Dundee curriculum, and I am one of the faculty member in the Anglia Ruskin University, which we started only about 4 years ago, is a government medical college, as you know, in the UK. All of them is the government. We give them intensive lecture in one topic, respiratory, and the next 6 weeks they will spend in the hospital. They will be assigned with the doctors from the consultant will be on the top, and there will be lots of the trainee doctors will supervise this student from the very first year. It's very important, you see, because you do not have much time. Now we have so many technologies to get things together and treat patients. We do not have time to read much. Obviously, reading is very, very important, but learning by seeing things is more important. As you know, audiovisual impact is more than when we just read it. Once you see a surgery, you just remember it, and you go home and you read a bit, and you are perfect. I tell you one story. When I went to the United Kingdom, I read about 2 years in British Library. I finished the MRCP Part 2 written in 2002. I went to see a patient in Royal Liverpool with a DVT. I was a foundation doctor there. We used to call house office. I didn't have a clue what to do with this patient. I have passed the MRCP Part 2 written. When I saw this individual patient one day, and I was a master of looking after the DVT and PE patient from the next day. So once seen, never forgotten. That's very important, and this is what we adopted. Every doctors in the United Kingdom who are in training post or non-training post, they will have a clinical supervisor and an educational supervisor, and this clinical and educational supervisor will feedback with other workplace-based assessment and submit this to the portfolio system to the deanery and the Joint Royal Colleges for an ARCP, we call it, Annual Review of the Competency Progression. I would like to urge you to implement something like this, and I'm very happy to share our various Royal College of Physicians, Surgeon, Gynecology and Obstetrician portfolio system, how we monitor and train our doctor for the future best world-class doctors, as you know, in the United Kingdom and the other American countries. I see, I do also, before I started Planetary Health with Bangladesh Society of Hematology, and we established a national MDT, and I'm so grateful to the PHA and Hematology Society and other training program director here present to give me the opportunities. And it is, I think it's one of the first national MDT in Bangladesh, has created lots of interest in other specialties as well. We bring together all the relevant specialists and discuss 5 complex cases from the nation and give the opinion how best we treat this patient. We do not sit only with the oncologist and the hematologist. We bring in radiotherapist, we could clinical oncologist, we bring our radiologist, our histopathologist, you name it. And we all discuss together, as Jakarullah Bhai said, this is the future, you see, learning. You can learn about a disease by reading 10 hours, but if you sit on an MDT, you will learn much more by just listening what happens to this patient journey and how we treat. And that's the way we improve the outcome of the patient, as it's been shown that 30% of the breast cancer outcomes improve when it works in an MDT approach rather than a professor is working on his own. So please do adopt in other specialties, and I'm very happy to share our ideas how we do establish it. I have just submitted this in the Lancet, and hopefully that will be published soon. So this is what I have to say. I think we have the BCPS, the president here, and the course director and other relevant authorities, and I will be, on behalf of the PHA, sitting together and discussing how best we can incorporate the e-portfolio system and the doctors in training portfolio to make them the better doctor for the future. With all this, I thank you very much again for giving me the opportunities to come here and share my experience and thoughts. Thank you very much.